Hello, I'm Dr. Brunaldi. I'm a clinical professor at the University of São Paulo in Brazil and former research collaborator with Mayo Clinic in Rochester, Minnesota.
Hello, my name is Barham. I'm the Director of Interventional Gastroenterology and the Executive Director and Associate Dean of Innovation at Cedars-Sinai Health System in Los Angeles, California.
So we're meeting here today to discuss our recently published paper called Comparative Effectiveness of Balloons, Adjustable Balloons, and Endoscopic Sleeve Gastroplasty, a network meta-analysis of randomized trials. So Barham, I'd like to start off by asking you, why did we feel the need to do this study?
Absolutely, Vitor. I think it's exciting times in the era of managing excess adiposity or obesity, because we're seeing the expansion of the treatment spectrum for patients suffering from this disease. We have the introduction of multiple successful pharmacotherapy options for the management of the disease. And in recent years, we've seen multiple trials that introduce endoscopy as a treatment modality for obesity and metabolic disease. And with endoscopy, we're seeing trials that include different classes of devices, such as space-occupying devices, similar to the intragastric balloon, or gastric remodeling techniques, what we refer to as endoscopic sleeve gastroplasty in this paper. So given that the field is maturing now and endobariatric is a legitimate field supported by level 1 evidence, we thought there's a need to give an informed decision to consumer about how these different interventions stack against each other. Because as you know, there's multiple randomized trial, but these randomized trial compare different devices to either a sham or a lifestyle control. And it's unlikely that we're going to have a trial that will have direct comparison between these different classes of devices or compare them against each other. But obviously, we need to help clinicians who are counseling patients how to view this class of evolving therapeutic options in that field. Therefore, we thought our best hope is to do indirect comparison using a network meta-analysis approach, where we were able to have indirect inference about the likelihood of success of these different interventions when we're counseling patients. Now, network meta-analysis is a little bit of a nuanced approach to answering some of these questions. Therefore, Vitor, I'm going to ask you to describe the methodology a little bit more and to summarize the results of the study, and then we'll have some discussion points along these lines after we do the summary.
Yeah, absolutely. So what we did, Barhan, is just we ran a broad search in Medline and Bayes and Cochrane Central from inception up to May last year. We considered eligible only randomized controlled trials because we wanted we wanted level 1 data, and we wanted to control bias as much as possible. And we compared what the EBTs, the endoscopic bariatric therapies that are currently commercially available in the US, namely the SPATS balloon, which is a adjustable 12-month indwelling balloon, the Orbera balloon, which is a fluid-filled 6-month indwelling balloon, and the endoscopic sleeve gastroplasty. The outcomes of interest were percent total weight loss, the rate of serious adverse events, and intolerability. So we ran this broad search strategy. We retrieved more than 800 citations, of which 10 were selected for the qualitative analysis and were scrutinized for the quality of evidence for the risk of bias. Amongst those 10 articles, 8 were eligible for the network meta-analysis and the quantitative analysis. And our results were very interesting. So when we talk about the total weight loss, all EBTs, they outperformed the controls. And we had 2 controls in this study. We had sham procedures, and we have the diet plus lifestyle intervention, the open label controls. So all EBTs outperformed the controls, both controls, in terms of weight loss, total weight loss. When we ran the network, and we could only run the network in terms of total weight loss because of the low rates of adverse events and tolerability. The most effective is probably the ESG, followed closely by SPAS3, and third by Orbera balloon. So this gives us like really good insight and helps us a lot in the decision-making process.
Excellent summary, Vitor, of this methodology and of the findings of the study. Now, I guess I'm going to put it a little bit in the context of the U.S. market, and then I'm going to ask you to put it in the context of what would the Brazilian market look like. So, lots to celebrate. There's more treatment options for patients, all supported by level 1 evidence. But obviously, now we need to make sure that we are using this comparative effectiveness when we're counseling our patients. And with comparative effectiveness, it's not just about an absolute weight loss number. It's the whole package that comes in the decision making. It's the weight loss, it's the adverse events profile, which obviously we could not elaborate on much in the network meta-analysis because most of these interventions were relatively safe. So it's very hard within these small numbers to compare these together. But also there is the patient preference, their lifestyle, what treatment that they could adopt and work with the life. There's costs that associated with that. So it's a more complex decision-making than just absolute numbers of absolute efficacy of the intervention. So I guess what I find the results of this meta-analysis to be helpful in that we have effective treatments. And now we have multiple options to offer our patients, and that is a good thing. Now, when we go to second-line reasoning, do I offer a balloon versus a gastric remodeling? That's when shared decision-making with the patient is going to be important because cost is not going to be much different in the US between an implantable device versus a gastric remodeling device. But some patients will the fact that it's completely anatomy sparing without alteration to the stomach would gravitate toward an implantable, knowing that its mechanism of action is going to be removed at some time period. For the SPATs in the US, it's 8 months versus 6 months for the Orbera. And then they're going to have to rely on their health to living program to carry the weight maintenance or on medications to carry the weight maintenance. Some people, that value proposition appeals to them. Others, they will tell you, no, I would like to have something that is more durable in the midterm. So we're looking at, instead of months, we're looking at 1 to 2 years in duration or longer. And therefore, they say, I will accept the anatomical manipulation of a gastric remodeling, such as endoscopic sleeve gastroplasty, and I will go with that option, given that cost is equivalent. The burden is somewhat similar on the patient. How do you see that from a Brazilian perspective, Vitor? How would that differ in your market, where I know that there is a cost differential between the gastric remodeling intervention and implantables?
Mm-hmm. That's a really nice way to see that in the US, Barham. Thank you for your views. Here in Brazil, there's this huge impact which comes from the fact that the gastric remodeling device is imported from the US. So that makes the cost go off the chart for the ESG. We feel in a clinical practice that the ESG outperforms balloons. If we feel that in a day-to-day basis, that is safer than the balloons. It's a one-off procedure. So we have this feeling that it seems like a better procedure. And when we find this data, which is extremely reliable data, it makes us even more comfortable to suggest this approach to the patients, regardless of the cost. So we can tell them we have strong data showing us that probably this is the best approach for you, despite of the costs. And then of course, as in the United States, that's more a patient preference than a medical decision. But we have one more factor to put on the scale and to help the patient make a clear decision, evidence-based decision. So I don't think that differs a lot from the United States, but it's another factor that will help the patient decide towards one procedure or the other, apart from the costs.
Fantastic. Well, I think that is congratulations on conducting and leading the study, Vitor. It's an important study. It's a good summary of the state of the evidence and how does it compare to each other, because we're trying to compare uh, different interventions here in one paper. And I think the readers will find it very helpful to take a deeper dive to get up to date on the state of the evidence when it comes to these trials, and then to start looking at the methods of network meta-analysis and some of the recommendation and the discussion points that we have in there. So congratulations, and I'm very happy to see this in print.
Thank you, Barham, for all the support, for the friendship, and let's keep on working together. Thank you for
Good.
watching.